Now, the next issue is, and this is, I would say, kind of a sad situation and an unfortunate thing is, what is your real graft count when you have your surgery? Okay, unfortunately, for example, let's say the doctor says, all right, we're going to do about 1,600 grafts today, right? Now you're in surgery, and they cut all the grafts, but you hear no one talking about numbers of grafts, counting the grafts, and so forth. It's very quiet, okay? Now, if you were in my procedure room, right, we are constantly tallying the number of grafts, right, because we are looking for a certain goal. If I want 1,500 grafts, and I only, let's say a patient opted to do a strip method, right, and I take a certain amount out of the back, and I only wind up with 1,300 grafts, I need to know that. Why? Because I need to take more out of the back to get to 1,500 or 1,700, whatever the goal was, you see? Now, quite often, the doctor will take a strip out of the back, and let's say he gets 1,300 grafts, but we estimated 1,700. It could happen that he'll say he got 1,700, and you'll never know unless you physically count every little puncture with a filled graft on your scalp, which is near impossible. Okay? So if you're having a procedure done and you're contracted or whatever, you're told you're getting so many grafts, my suggestion to you is while you're in the procedure room, I would ask the staff and say, oh, how many grafts do you have? How many are you up to? What's the count? You see, these things are important, these terms and words. Okay? If it is very silent in there, and no one's talking about, well, how much do you have? How many singles do you have? How many double grafts do you have? How many this or that? And no numbers are discussed, that's highly unusual, because that discussion needs to take place, and the doctor needs to know exactly how many grafts have been cut or dissected. Otherwise, we want to obviously meet the patient's expectations for the day. If we need to take more out of the back, we do so. Okay, but unfortunately, that doctors sometimes do not like to go back into the scalp to recut another piece and then to suture it back up and then to have dissection continue. You see, it becomes like a nuisance, but it shouldn't be thought of that way. The objective is to have a plan with the patient, right? We discuss, well, we think 1,700 will fit up there, and the doctor who does this knows full well what he could fit up there, okay, from his experience. And then if we come short on our count, let's say 1,400 grafts, it behooves the doctor to go back in there into the donor area and take out more to get to that count. End of story. Okay, end of story. Okay, so if you're in the procedure room, I would encourage you to ask any of the nurses or staff members, medical assistants, how many did we get? What's the count? Okay, that's important. Now, moving on to the next issue, okay, would be undue influence after taking a sedative or a narcotic, for example. Let's say I come in for a hair transplant, and I'm giving Halcyon or Valium or something like that, codeine, whatever the case is, that can alter your judgment or ability to make decisions. Now, we move you off right into the surgery room, procedure room, and what happens is we projected that you needed 1,500 grafts, right? But we overcut on the strip method and we got 1,700 grafts. So that's 200 extra grafts. Now, the doctor possibly may say to you, look, we got 200 extra grafts, we're going to need to charge you more. Okay? Now, at that point in time, are you in any condition to negotiate an error on the doctor's part to pay more for something that you didn't know about prior? You see? In actuality, if it's the doctor's error and it was not discussed prior to the procedure, for example, if I said you're going to get 1,500 grafts and it's going to cost X amount of dollars, and it was not discussed that if you got extra grafts that you'd be charged more, and you agreed to that prior to sedation or narcotic use, and all of a sudden now there's negotiations going on under that influence. That is not right to do that. Okay, that's a serious issue. Okay, and that's just basically 8 things we're going to discuss for today. But I feel those are the 8 major issues a patient should be aware of and beware of. Okay, so hopefully while you're having your procedure, or if you finished your procedure, hopefully you're happy with the results. Hopefully you got the number of grafts that were told that you would get. And hopefully that you were given the appropriate procedure, etc., etc., etc. You see? So if you have any questions on fraudulent, illegal, unethical, or scams that you may have been part of, okay, my suggestion to you is you don't necessarily have to call a lawyer immediately. I'd call your doctor, okay, and discuss it with him. Okay, that's always the best thing first. I feel that's the best thing to do first, is discuss it with your doctor. And discuss and say, you know, doctor, so-and-so, this happened, I'm a little upset about that, and could we fix the problem? Okay, now, some of these are difficult to fix, because a doctor is not going to say, well, yeah, we only got 1,300 grafts, but we charge you for 1,700. Now, no doctor would admit to that error. Okay, however, there are certain things you can discuss. For example, if there was a free consultation like we mentioned, and you booked and signed on the day during that consultation, you are entitled to all of your money back, and any procedures after that, as a matter of fact. And that you'd have to check the law about, but I'm most certain about that particular procedure, and most likely all subsequent procedures. Okay. Again, the high pressure sale thing. Just again, I don't want to go through all of them again, but again, be aware of these things. If you have a question, you can always email me. If you feel comfortable doing so, you're welcome to do so. Okay. If you feel you need to contact an attorney, I'll put that last on the list. Okay, because usually doctors are approachable. Most are approachable. Most will admit if there was something wrong in, let's say, logging the grafts, maybe the count was wrong or whatever the case was. Most will do the right thing if something was done in an unethical, in a fraudulent manner. Okay, and sometimes a staff member might actually be doing the fraudulent activity. Like, for example, again, this might sound unusual, but sometimes a salesman or upfront person that tries to sell you the hair transplant actually gets a % of the sale. I don't believe that's legal in Florida. That's called fee splitting, but that you would have to check with an attorney. But you see that there's a conflict of interest where if they're gaining from the increased numbers of grafts and procedures that you do, okay, if they're gaining from that, and that's their source of living, well, generally a salesman, what do they want to do? They want to sell, right? Now, these are the types of goods that should not be sold like cars, okay, or china or computers or whatever, okay? And I believe, again, this is probably a minimally unethical activity, okay? A lawyer would know if it's illegal. I'm not sure if that would be considered fee splitting and so forth. But beware of salespeople who are on commission, okay? You might want to even ask that question. And if you feel that that was the case, then you might want to question the doctor. You always go back to the doctor first, okay? And if he could rectify it to your satisfaction, then it ends there, okay? If he cannot, then it's up to you on how far you want to take it, okay? So I think we said enough about these issues. If other issues come up, that's not on my top 8 list here, okay? I couldn't think of 10. We got the top 8. If there are other issues, you could bring it to my attention. You can email me on my website. There's a contact information if you have a question about something that happened in the past or a procedure that you're undergoing now. I have no problem discussing that with anybody, All right? So again, beware and be cautious.